Dr. Atul, can we have your next talk? Yeah. Which talk did you finish? Yes, diathermy. So this is about intraocular diathermy for retinal surgeries. Yes.
Don't start the timer, please. Please restart from the beginning. Is there volume in this? Dr. Atul, is there volume in it?
No.
Okay. Right. Please go ahead. Start it, please.
Timer should be changed, no? 1 minute.
Yeah. He's got it.
This is a typical advanced diabetic vitrectomy case that you see here. So my sir is dissecting the membrane. I was the assisting surgeon. So I was observing, he was dissecting the membrane, it started bleeding. He took out his cutter, he introduced a cautery inside, and he tried to cauterize the bleed. So he's cauterizing it and at the same time trying to dissect it a bit. So as you can see, the bleeder has been cauterized, and he took out the cautery outside and came back in. By the time he came back in, the bleeding profuse. It was bleeding from some other side or from the same side, we don't know. But then the entire field is filled with blood. So this is what happens in a typical advanced diabetic vitrectomy when you do. So I thought to myself, how could I have helped my sir in avoiding this? Can I do something? Can I do something to prevent this from happening? So with that idea in mind, I decided to develop an intraocular diathermy instrument, a challenge that we overcome in vitreoretinal surgery, IDI. So let's look at the existing scenario. The conventional diathermy probe is point-shaped. The surgeon must push on the blood vessel with a probe to close it and then coagulate it. High energy levels are needed to coagulate the distal blood vessel, leading to collateral damage. And tip of the diathermy probe can block the surgeon's view. And there is always, like you saw in the video a while ago, there is a delay between the removal of that instrument, then introduction of the next instrument, and then cauterizing the bleeder. So this excessive bleeding prevents people from doing a good advanced diabetic vitrectomy procedure. Sorry. So with these ideas in mind, I thought to myself, how can I combine a membrane peeling forceps with diathermy? Can I give a membrane peeling forceps the ability to cauterize, diathermize? So with this idea in mind, after some brainstorming, so we wanted an instrument that can apply mechanical pressure from both the sides. So if I have a membrane, I want to apply mechanical pressure from both the sides. It should diathermize the membrane, and also I should be able to peel it off. So all these three things happens in tandem in a go. So we wanted a similar instrument. So with this, we wanted the instrument to be conductive, but we did not want the heat to be dissipated in the shaft, only at the tip. Good temper and hardness, and can be operated with a foot switch. So I don't want it cauterizing every time I hold a membrane. I want it cauterizing when I want it to. So I will have a separate foot switch for it to cauterize. But the ability to close the prong, it will be on the handle. So with this idea in mind, we developed the first prototype with the assistance of Chennai Surgicals. So as you can see in the image, the round cross section at the top, so it has an inner cylinder and an outer cylinder. The outer cylinder is connected to one pole of the cautery and is connected to one prong of the forceps. The inner cylinder is connected to the other prong and to the next pole of the cautery. So what happens is when these two prongs come in contact, the electric circuit is completed and the tip of it cauterizes. But both the cylinders are insulated by an insulation material. So that there is no conduction elsewhere but at the tip. Now we have developed it in 20 gauge, and this is a push button system in which the button is pressed so that the forceps comes and closes the membrane, and you have a foot switch which will be giving the cauterizing ability. So now we are going on to make the 23 and 25 gauge instrument, because we don't want to go forward with 20 gauge because 20 gauge is the era has passed. So now we are working on this. And as you can see in the video below, we are now also working on combining endolight with endolaser. Usually what happens is when you laser the retina, you need a separate port. Thank you.
Very nice.
I think it's quite innovative.
Thank you,
But
sir.
my question was that once you are pressing on that knob to close the forceps, our usual hand working is to
Yes, sir.
just work like a forceps kind of thing.
Ye-
So how would that push button help in?
So the 20 gauge
Yeah.
is made just with the push button. The 23 and 25 gauge, we are making a 360-degree pressing mechanism, just as we have in the Alcon grease saber or the shark skin forceps, which we have a 360-degree grasping mechanism, which all the retina surgeons use.
So that has not been developed yet.
No,
It's
grip
in
the grip
the
switch is already
process.
the grip switch is already there, sir. We just have to combine it because it's a prototype. The switch making is an expensive process. So the prototype we just went with the because the resources are limited. We don't want to waste resources. So
Okay, very nice.
yes,
Thank
sir.
you, Dr. Atul. Excellent.